Topping news tonight, the Ministry of Social Services and Urban Development assuring the government's commitment to helping Bahamians in need with essentials like food, rental assistance, and help for the disabled. The Honorable Frankie Campbell, the Minister of Social Services, detailing how funds dispersed in the midst of COVID-19 have been allocated. He also outlined plans to relocate boarders who have called the Princess Margaret Hospital home for years. Here's Jiminita Swain.
Social Services officials now providing a dollar figure for boarders to be relocated from the Princess Margaret Hospital, freeing up critical bed space as demand grew during the COVID-19 outbreak. Social Services and Urban Development Minister, the Honorable Frankie Campbell, in his report to the nation Thursday, explained how the boarders issue was addressed.
The Ministry of Social Services and Urban Development and the Ministry of Health worked in tandem to relocate the boarders from the Princess Margaret Hospital to senior residential facilities. This joint effort is budgeted to cost approximately $800,000 in the first year for care and needs of the residents. Expensive is a relative term, and when you relate that to the near $6 million that was being spent or paid for them while they were in hospital, I think the cost is quite inexpensive.
Health officials estimated about $6 million annually being expensed for their care. Now that some solution has been provided, Minister Campbell said the ideal position would be for loved ones to reduce the expenses or take over their relatives' care. As to the next step,
at least 25 of them, if I'm not mistaken, are being taken to a home that is not government owned. So that's where the chunk of the money is going. Also appreciate that those boarders are at an age where they call for additional care, constant care. And so we are paying to ensure that those boarders, while taken out of the hospital, are not treated any less, are not given any less attention than they would have been receiving at the Princess Margaret Hospital.
And those boarders will be relocated once health officials determine they are COVID-free. Meantime, Social Services officials are also responsible for child protection, the disabled, senior citizens, and food assistance to those in need.
The National Food Distribution Task Force has distributed food parcels and vouchers to approximately 55,078 households throughout the Bahamas up to September 12th. The need for continued food assistance through the task force is still of paramount importance, and as such, the government of the Bahamas has committed to the continued partnership to the end of October 2020.
Minister Campbell says feeding everyone remains a priority for the government. However, he made it clear the plan is not for persons to receive food from Social Services and the National Food Distribution Task Force, which was specifically designed to assist persons in need as a result of the COVID-19 pandemic and the downturn in the economy. Jiminita Swain, ZNS Network News.